What is depression and what are the treatments for it? According to the World Health Organization, in 2023, approximately 280 million people in the world suffer from depression. And according to Chand and Arif, 60% of people with depression do not seek medical help. So in this video, I will be describing the symptoms of depression and critiquing the research on effective treatments. The National Institute of Mental Health defined depression in 2023 as a common but serious mood disorder, which causes severe symptoms that affect how a person feels, thinks, and handles daily activities, such as sleeping, eating, or working. To look further into depression as a psychological disorder, I will cover in this video the symptoms of depression, 4 different types of treatment, and I will go on to critique their effectiveness. There are 3 main categories in relation to the symptoms of depression. These are emotional, cognitive, and somatic. Emotional symptoms include sadness, hopelessness, and anxiety, along with misery and an inability to enjoy. The next category is cognitive symptoms, which are negative connotations about self, world, and future, which was first proposed in Beck's cognitive triad in 1967. The final type of symptoms are somatic. These are physical. This includes loss of appetite, lack of energy, sleep difficulties, and can also cause weight loss or gain. The types of treatments I will cover in this video are cognitive behavior therapy, serotonin and norepinephrine reuptake inhibitors, transcranial magnetic stimulation, and herbal supplements. I will look at what each treatment is, discuss research surrounding it, and critique their effectiveness in helping treat depression. Cognitive behavioral therapy. CBT is a talking therapy that emphasizes the change in our cognition and the behaviors associated with these changes. It is the idea that altering the way a person perceives a stressor may alter their psychological and emotional reactions to it. Over the course of 46 months, 43% of those who had received CBT had improved, reporting at least a 50% reduction in symptoms of depression. In 2010, meta-analysis found CBT to be equally effective in comparison to other psychological treatments, but other studies, also in 2010, found CBT more favourable. Another example of where CBT is effective is when combined with antidepressants. In a study, 86% of participants who had a combination of CBT and antidepressants improved significantly. However, a critique of cognitive behavioral therapy is that there is not enough evidence to assess its long-term effects. Thus, depression is seen as a relapsing chronic illness, and without long-term comparative follow-up studies, it is too early to champion any one therapy. Serotonin and norepinephrine reuptake inhibitors. SNRIs are a class of medication that are effective in treating depression. Like most antidepressants, SNRIs work by affecting brain chemistry and communication in brain nerve cell circuitry known to regulate mood, to help relieve depression. SNRIs block the reabsorption of the neurotransmitters serotonin and norepinephrine in the brain. They are used to combat irritability and sadness. A meta-analysis, Furukawa et al., examined the efficiency of SNRIs in treating depression. The study concluded that the use of SNRIs were proven more effective than placebos. In addition, a once-daily dosage creates consistency drug levels in the bloodstream, which is important for optimizing therapeutic effects and minimizing fluctuations in symptom control. Also, common side effects of SNRIs include nausea, headaches, dizziness, insomnia, and dry mouth. And although they may be bothersome, they are usually mild and tend to improve over time as the body adjusts to the medication. Antidepressants, including SNRIs, carry a black box warning regarding an increased risk of suicidal thoughts and behaviors, and careful consideration should be taken when prescribing SNRIs. Transcranial magnetic stimulation. TMS uses targeted magnetic fields on parts of the brain that are involved with depression. TMS has great success. 50 to 60% of patients suffering from depression who have tried and failed to receive benefits from medication experience positive results from TMS. About 1/3 experience a full remission. In addition, TMS is a non-invasive treatment. This means that it is done without using surgery or cutting the skin, as it is done through magnetic pulses. One of the main positives is that TMS potentially may prevent suicide. Research suggests that it may prevent and reduce suicidal thoughts in individuals living with depression. However, although it is rare and does not affect most patients who receive this treatment, there is a possibility of seizures in patients who receive TMS, as there have been cases where this has happened. Herbal supplements. Herbal medicines are those with ingredients made from plant parts, such as leaves, roots, or flowers. Some people look to manage depression with herbal remedies, rather than prescribed medication. Saffron, which comes from the Crocus sativus flower, has shown effects comparable to standard antidepressant drugs, such as fluoxetine. In addition, the less expensive petal extracts have been found to be effective substitutes. Many other herbal alternatives have similar effects, such as kava and ginkgo biloba. Recently, herbal medicines have received attention as a cheaper alternative to synthetic antidepressants and show fewer symptoms than prescribed medication. However, using herbal supplements while taking other medications can make the medication less effective or cause the other medicine to trigger unexpected side effects. The clinical effects of herbal medicines usually only appear after longer periods of administration. Therefore, clinical trials would have to be longer and larger, meaning that they would be more expensive. But single herbal manufacturers are usually small and typically not financially powerful, so there is little money to fund larger clinical trials. The symptoms of depression vary for each person, with the severity being different for everyone. With a range of treatments, it makes getting help more accessible. CBT has proven to have long-term benefits. SNRIs create consistency with a once-daily dosage. TMS has worked for those whose treatments have failed previously, and herbal supplements have proven as successful as antidepressants in some cases. This does not mean that these treatments are perfect, as they all come with their downfalls. This is because there is little research on some treatments, with others causing seizures or increased risk of suicidal thoughts. No treatment for depression is 100% effective, and they work differently for everyone and come in all different forms. But as research develops, helping treat depression will become more accessible and more reliable. Thank you for listening. I hope this has helped you understand some of the symptoms of depression and 4 of the treatments available.